Good morning, my name is Jenny Agustin Fabros from JBSNA 1-2. So for today's demonstration, I will demonstrate what to do when someone is experiencing seizure. Okay, so for now, I will discuss what is seizure. Seizure is also known as the convulsion or fit can be caused by the disruption to the electrical activity in the brain, which may lead someone to uncontrollable contraction in muscles and unresponsiveness. And if a seizure occurs, the most causes is epilepsy, alcohol, poisoning, lack of oxygen, after head injury, after taking certain drugs, and a low glucose levels, a hypo in a diabetic. And what to look for when someone is experiencing a seizure? There are 8. Number 1 is suddenly unresponsiveness. Number 2 is the rigid body. Number 3 is the arc back. And then the number 4 is a noisy due to difficulty breathing of the patient or the client. Number 5 is the convulsive movements. Number 6 is the saliva at the mouth of the patient or the client. Number 7 is the loss of bladder or the bowel control. And then the last one is after they could fall into a deep sleep. Okay, the next thing is what to do when someone is experiencing seizure. One is to make sure to make space around casualty. We should remove dangerous objects that can harm themselves. Second is to note the time of the seizure started. We need to note the time of the seizure to able to know if we need to call 911 or ambulance for help. And then the third one is to protect their head using a pillow or a blanket around you or near you. And then when the seizure stops, open the airway, check for their breathing, and when breathing out in the recovery position, if the patient is breathing. And when do we need to call 911 for help? If this is the patient's first seizure, and for unknown cause, if this is the repeated seizure for the client or the patient, and then the seizure longer than 5 minutes, that's why we need to note the time when the seizure is started. And unresponsiveness for more than 10 minutes. Sustain in injury. So okay, now we can imagine this caregiver is experiencing seizure now. And then first thing we need to do is to remove all dangerous things that can hurt themselves. Just like a chair, tables, wound, anything that can cause to hurt themselves. And then the next one is to protect their head using a pillow or a blanket near you. And then the next thing we do is to note the time of the seizure. Check their breathing. And that's it.